Hi everybody, my name is Rebecca Medansky and I am a pelvic floor physical therapist and the owner of Ladybird PT, a clinic in Austin, Texas, focusing on helping pregnant people manage pregnancy pains, prepare for birth, and recover postpartum. And today, I'm here to talk to you about C-section scar desensitization. Now, if you had a C-section recently, or if you are months, years postpartum following a cesarean birth, desensitization can be really helpful. But it's important to point out that desensitization is different than scar massage. If you're interested in learning more about scar massage, look to our next video. I'm going to be recording a part 2 to this. It's going to be diving into scar massage, which is just different. Now, when we would want to do C-section scar desensitization, if you are somebody who has a hard time touching your scar, who has a hard time looking at your scar, who feels like your scar is really uncomfortable when you wear jeans or you feel anything press up against it, or if you feel uncomfortable leaning against a hard surface, those might all be signs that your scar is hypersensitive or overly sensitized. I'm not calling you sensitive. I'm saying that your scar and the tissue surrounding the scar is sensitized. But fortunately, there are a lot of things that we can do about that, and I'm going to be showing you how today. But before we get into that, let's first talk about why this happens at all. Why do scars get sensitive? Why do cesarean scars get sensitive? And the answer to this can be kind of simple or kind of complex. There are a lot of reasons why people develop sensitivities in the body. Oftentimes following a trauma, that can be something like a motor vehicle accident, which is an uncontrolled trauma, or a surgery, which is more of a controlled trauma, any sort of trauma to the tissue, the body typically responds by protecting. We do this by guarding. That's why after a car accident, you might develop whiplash. Your neck can get really stiff. But after a car accident, after you develop whiplash, eventually you start moving, you use a hot pack, you start stretching, moving around a little bit, maybe you go to physical therapy, and it gets better. But after a cesarean birth, people often don't go through that same natural progression because they just don't know how. We don't know what we're supposed to do. So when a C-section or an abdomen gets hypersensitized, we don't know where to go from there. And I'll link one of our blog posts below where you can learn more about C-section scar care and management. But that is one major reason why people can develop hypersensitivity. The muscles in the area tighten up to protect you, they guard you, and then they stay that way. And all the nerves, the fascia, the skin, they all get hypersensitized. So the way that we calm down hypersensitivity is desensitization, and we do this as a slow, gradual process. Now, as I'm walking you through how to do this, keep in mind it should be relatively pain-free. It might be uncomfortable. It should never be painful. If it is painful, if you are having any increased redness, swelling, soreness in the area, please make sure that you're contacting your medical provider. This is not meant to take the place of medical advice. But if you feel like this tissue is healed, it's just really sensitive, this is for you. Again, it should be pretty pain-free. You should not feel like you're blowing through your comfort barriers. Everything about desensitization is meant to gently increase your body's comfort level when being touched by different types of materials. So we're going to start really gentle and we're going to progress, and I'm going to teach you how. Keep in mind this progression that I'm going to take you through might be done over the course of one session. It might be done over the course of days, over the course of weeks. It all depends on you, on your body, how sensitive you are, and how quickly you're able to calm that sensitivity down. So this is very much so a choose your own adventure. I'm just here to guide you and offer you some options. So what we're going to do, I'm first going to grab my materials. For planning, I didn't bring them over with me. And I am going to walk you through desensitization of a scar. Now, where we're going to start is with something nice and gentle, and you're not going to see my face, but you're going to hear my voice because I want you to see what I'm doing. So the first thing you want to do is start by exposing the scar. All right, so you expose the scar and you start with something really soft. I'm starting with a Q-tip. You can start with a cotton ball. And the first thing that you do is just start touching the scar with that Q-tip, cotton ball, whatever it is. And you want to go along the whole length of the scar, back and forth. You can even go a little bit above and below the tissue, but you want to just get your body comfortable to this kind of touch. Now, if this feels like too much, this is where you hang out. And that might be true for, like I said, hours, days, weeks. The whole process of desensitization, I don't recommend that you spend more than maybe 5 to 10 minutes doing this per day. So it's okay if you just stick with this. And it's even okay if you don't move it around a whole lot at first. You might start just kind of touching and rolling. That is fine. Start there, hang out there if that's what feels right for you. Over the course of, let's say, days, weeks, however long, this starts to feel fine, then what you do is you move on to something a little bit rougher. Now, I have not a very old, a relatively new t-shirt, and it's a little bit rougher than a cotton ball. So now I'm gonna do the same thing with that. Now, typically you can do this laying down. It's just easier for me to film standing up. And you start the same way. You can do circles over the scar. You can go up, down, back and forth. You can just slide back and forth using various pressure, but you're getting your scar used to this slightly rougher material. And again, you can do this for days, weeks, months, however long it takes. Months is probably, if it's taking you that long, I would recommend getting personalized one-on-one guidance. But you move on to something rougher once that feels fine for you. So for me here, I have a paper towel. It's a lot rougher than my t-shirt, and I'm gonna do the same thing. I can do circles, up, down, side to side, all the way along the length of my scar. I repeat as needed, and then once that feels fine, I move on to something even rougher, like an old towel, a rough towel, jeans. You can continue on this progression for as long as you need to. If this isn't enough to make you feel more comfortable wearing pants leaning against the surface, you can move on to rougher and rougher materials, again, over the course of days, weeks. But I hope that this helps. I hope that if you're watching this and you're cringing, you at least feel like you can start with something gentle. And if all of that feels like way too much for you and you're watching this and you're like, no way in hell, then all that you need to do is start with belly breathing. You don't even have to touch your scar. Just start with deep belly breathing to calm your nervous system, to allow your belly to expand, and contact a pelvic floor physical therapist who can help create a personalized plan for you. Sometimes it is a lot easier to have somebody else work on this rather than doing it yourself. So again, if this doesn't feel like it's the right fit, contact your provider, see a pelvic floor PT. You're welcome to work with us if you're here in Austin, Texas, or you can work with us virtually if you are anywhere in the world. But there are plenty of pelvic floor physical therapists all over the country and all over the world here to help you. If you have comments, questions, concerns, comment below. And thanks so much for joining us.